Denver was little more than a grubby frontier outpost when its first hospital opened in a small log cabin at the corner of Wazee and 16th. Many doctors had come west during the gold rush of 1859. Most were unsuccessful in their search for riches, but they soon found an abundance of ailments to treat, including fevers, TB, gunshot wounds, stabbings, dysentery, and syphilis. In those days, a routine house call was $3. In bad weather or at night, the fee was doubled. Over the next few years, the city hospital treated the sick and the poor at a succession of temporary facilities. No one was turned away. As the Denver Post wrote in 1869, white outlaw or Indian chief was given equal considerations. In 1873, a parcel of land was donated at 6th and Cherokee. On this site grew the Arapahoe County Hospital, the forerunner of today's Denver Health.
It's been a very interesting evolution because it started off like every other public hospital on the East Coast and the West Coast, but it evolved into a program that served every component of the community. The rich, the poor, those with emergency services, because at one time it took care of 1/3 of the city of Denver, and we needed the political support of 3/3 of the city of Denver. So we actually got into the business of serving everybody. And with that kind of a political impact, the city said, this is our institution. And we've been supported ever since.
As Colorado's first safety net institution, the hospital was a vital resource to those in need. Emergency care was little more than scoop and run when the hospital acquired its first horse-drawn ambulance in 1879. Still, it could take hours to get treatment.
EMS system in Denver, as I understand it, was one of the pioneers in really developing a comprehensive system. But in order to provide care to that, it was important for us also to establish a trauma service. And since then, of course, we've matured considerably so that we not only serve as a safety net for Denver County, but also the surrounding region.
Today, Denver Health paramedics respond to over 80,000 calls each year. And Denver Health's Rocky Mountain Regional Trauma Center, Denver's only academic Level 1 trauma center, according to the American College of Surgeons, has the single best survival rate in the nation. Denver General Hospital was fortunate to have been influenced by a variety of exceptional individuals, such as Dr. Justina Ford, Denver's first African-American female doctor, Louis Croft Boyd, who established the hospital's nursing school, and Dr. Florence Sabin, the well-known public health visionary. The city breathed new life into Denver General in the 1960s, with a new hospital and the establishment of a network of community health centers and school-based clinics in Denver's most underserved and vulnerable neighborhoods and schools. Then, in 1997, Denver Mayor Wellington Webb and Dr. Patty Gabeau, the health and hospitals manager, took a giant step toward the future when they converted Denver General from a department of the city to an authority, the Denver Health and Hospitals Authority. The result of this bold shift to an authority has resulted in the birth of a model for the nation in healthcare delivery.
So during our administration, through the support of members of City Council and the Mayor's Office and Denver General Hospital staff, we came up with a new structure which would require state approval to create a new state-chartered hospital entity named Denver Health with a public mission. I think that Denver Health should be named in the same breath as Mayo Clinic and Johns Hopkins. And until that is achieved, we have not hit the mark. But I think that this model is one that works and should be replicated around the country.
The past 150 years have seen a lot of changes on this site, but one relic of the past remains: a 165-foot tall smokestack which continues to watch over the generations of families who found refuge and healing at Denver Health.
I think some things about Denver Health haven't changed over 150 years, and they won't. And that is our core mission, to really serve people who are vulnerable and in need, and to serve them with extremely high quality, to serve them in a way that preserves human dignity. And I think that that's not going to change.
If you look at all the services that Denver Health provides to the citizens of Denver and to the metropolitan area, I mean, fully a third of the kids in Denver are born in Denver Health. You know, a huge percentage of the, I think almost 40% of the total population gets their health care, primary care from Denver Health. They are everywhere, and they are one of the only integrated healthcare systems in an urban setting in the entire United States of America. And we take them for granted at our peril. Congratulations to Denver Health on 150 years. That is a remarkable achievement, and the city, the entire county, the entire region is in your debt.
Congratulations to Denver Health on 150 years. You look better today than you did when you started.